Today we're going to start Chapter 16 in the Coding Handbook, which is titled Mental Disorders. This corresponds to Chapter 5 in our code book, Mental, Behavioral, and Neurodevelopmental Disorders. As a reminder, you are not going to do any procedure coding, so you can skip over those parts of the exercises that ask for procedures. I also want you to be aware of the DSM-5 that it is a code book that's used by psychologists and psychiatrists, but that's all you need to know about it for this course. Abuse versus dependence. Understand that there is a difference, and dependence is the far more serious of the two. Dependence is linked typically to someone being willing to break the law to continue their habit, and it also causes them withdrawal symptoms when they stop using. This is a hierarchy that is in our coding handbook as well as in the coding guideline. That if you see these terms used in the same documentation, there is a hierarchy as to how you are going to code them. Going through the bullet points, I won't read them all, but using the first one for example, if your documentation says both use and abuse, you're going to code only the abuse code. There's a use code, an abuse code, and a dependence code. So that's why you have to have a hierarchy of how you're going to code them. The second bullet point, if both abuse and dependence are documented, you're coding only the dependence. So what you see is the more serious of the two terms is the one that you're going to code. So let's look at an example. This exercise is not in the coding handbook. The patient is admitted to the hospital emergency department where he was evaluated for severe pain in his lower back. We will admit him today to rule out a kidney stone. The patient is known to the ED staff as a cocaine user. He has suffered withdrawal in the past 6 months when he came to the ED with severe nausea and vomiting, but there are no reports of any withdrawal thus far. A psychiatric evaluation was ordered to determine if rehab might be an option this time. There are several things we want to look at as a coder when we get ready to code this. First of all, two things were talked about, the user and the withdrawal. Withdrawal indicates dependence. So in that case, because of our hierarchy and our coding guideline, we're only going to code the dependence. We're not going to code the use. Also, what you may remember from our general guidelines, in a hospital, inpatient stay, you can code a rule out. So in this case, the physician mentioned rule out a kidney stone right here. Because it's an inpatient, you can code that kidney stone. And that's where we have here in our pathway. Kidney stone, another word for that is calculus. So you go into your alphabetical index, calculus, subterm kidney, takes you to N20.0. Your dependence, subterm drug, subterm cocaine, takes you to F14.20. I also want to bring up another thing that has to do with the Section 3 reporting additional diagnosis guidelines, and that would be, in this case, we would code the cocaine dependence because this last line here, the doctor has ordered a psychiatric evaluation. So one of the Section 3 guidelines is clinical evaluation. Take a minute and look in your guidelines at the Section 3. There are several bullet points for what makes a diagnosis reportable, and review those because those are things that are going to keep coming up moving through the course. There's another guideline that talks about in remission. A coder cannot select code F10.21, alcohol dependence in remission, unless the physician has said so. This is one of those very specific cases that the nursing documentation or a therapist documentation is not going to get it. You have to have the provider's clinical judgment. That is true also for the in remission option for categories F11 through F19, and this is, as I said, a coding guideline. So here's some examples just to keep us straight. If the physician documented in the medical record the patient's alcoholism is in remission, you're going to code that F10.21. If the nursing note mentioned that the patient is in remission since he's been hospitalized without any alcohol for the last week, that is her statement, not the provider's judgment. So even though it may be true, you cannot code from the nursing note. You can only code from the physician's note that indicates his or her clinical judgment. When a patient has a drug dependence and is on medications for detox or for any maintenance programs to prevent withdrawal, an example is methadone, the appropriate code for the drug dependence is assigned rather than a code for the methadone or any other drug that's being given to help withdrawal. So here's an example of a case. The patient is a 33-year-old female admitted to the third floor for a fractured left ankle. And I give the example of how specific we can code here. It is a bimalleolar fracture, non-displaced. She suffered in a fall in the detox unit this morning. She's been on methadone several weeks, trying to end her opiate dependence. She will continue to be followed by drug and alcohol therapists while she is here for treatment of the ankle fracture. So on the right here, I have the pathway for how you would get to this S82 category code. And here is the code for the opioid drug dependence. And I'm bringing to your attention again to note that the opioid dependence is reportable as a secondary diagnosis because the patient is receiving treatment, in this case therapy, while she's in the hospital. She's in the hospital for the broken ankle, but because she's receiving therapy for the opiate dependence, we do code that as a secondary code here. Code 54 classifies psychological and behavioral factors associated with diseases classified elsewhere. This is one of those that you're going to see often associated with asthma, ulcerative colitis, or dermatitis, but there are other disorders that could also have a psychogenic component. Here's an example of one. Psychogenic paroxysmal atrial tachycardia. The tachycardia, here's your pathway. And then when you're coding the psychogenic part of that right here, you're going to start with your main term, psychogenic, then your subterm, factors associated with physical conditions. In the tabular, under F54, there's an instructional note that says code first, the associated physical disorder. So as with many examples we've looked at in this class, often the instructional notes help us know how to sequence these codes. PTSD, something you've probably all heard of. I bring this to your attention because we have not used any of the Y codes yet in this course. This young woman suffers from chronic PTSD as a result of war activity. So PTSD, post-traumatic stress disorder, we're going to start with the main term disorder, post-traumatic stress, and that gives us F43.12. Also note the chronic is an essential modifier in this case. It's something we do need to be able to code. In our coding handbook on page 178, it mentions Chapter 20, External Causes of Morbidity, and suggests finding the block that includes activities of war. And that's how I would suggest finding the codes when you have these kinds of cases. And I want to show you that in our code book. And here you see we're in Chapter 20, External Causes of Morbidity, and let's see, why, I'll go up a little bit. Here we go. Legal intervention, operations of war. So this tells you where you would start looking for this particular code. Some of the hospitals don't use the Chapter 20 codes, but you would know when you're hired whether or not you're supposed to assign those. Here's an exercise not in the coding handbook. The patient is a 27-year-old male hospitalized for a fractured right humerus, initial encounter. According to the H&P, he uses marijuana recreationally and has a beer or two every night. In this case, we would not code the marijuana or the beer because of this guideline. As with all other diagnoses, the codes for substance abuse should only be assigned based on provider documentation and when they meet the definition of a reportable diagnosis. Codes are to be used only when the psychoactive substance use is associated with a mental or behavioral disorder and such a relationship is documented by the provider. I think I want us to look at that section 3 just to be sure that you know what I'm talking about. So this is the section that I'm referring to. Section 3, reporting additional diagnosis. It's in your guidelines, so just page through until you find it. If you're wondering as a coder whether or not you code something during a hospitalization, you have to see if these other diagnoses are affecting the patient's care. In other words, is it requiring a clinical evaluation? Is it requiring a therapy? Is it requiring a diagnostic procedure? Is it extending the length of the hospital stay? Or is it requiring increased nursing care and or monitoring? A diagnosis has to meet one of those 5 things in order for it to be reportable. So in this case that we just looked at, if we go back and look at this one, you see that he mentions the marijuana and the beer, but this particular hospitalization is only for that fractured right humerus, nothing else. So we don't even have to code the marijuana or the beer. Okay, here's another exercise. Pain with the psychological components. We have a guideline that directly addresses any pain disorders that are related to psychological factors. And in this case, the patient is a 46-year-old female complaining of chronic pain due to trauma. The physician feels there is a psychological component to her pain. So even though we're going to code that G8921 as her pain, chronic pain, we're also going to code the pain disorder, F45.42. So on the next slide, I have the actual pathway here. Here's your pain, subterm chronic, subterm due to trauma, gives us G89.21, and pain psychogenic any site gives us F45.41. And in this case, what happens is the alphabetical index is one of those where it gets us to the neighborhood, but when we go to the tabular, we're going to find the right code. So let's look up F4541 and see if it does indeed meet our needs. And when we get in the tabular, we have a pain disorder exclusively related to psychological factors, or we have a pain disorder with related psychological factors. Code also any associated acute or chronic pain. So even though the alphabetical index took us here, once we go in the tabular and we read, this F45.42 is the better code for us because it relates the fact that this patient does have chronic pain because we gave her a G89 code, and this is the correct psychogenic code, not this. So again, just another example of the alphabetical index getting you in the neighborhood, but not necessarily in the right house. This is one of those cases where you may not know which main term you're going to use, so you're just going to try. You may think you had to use paranoia or alcohol. So this is just showing you the correct pathway with psychosis being your main term, and then following your indentations to get to F10.250. I bring this one to your attention to talk about the blood alcohol level. And it's one of those things in Chapter 20 that I mentioned earlier. I think the easiest way to find them is to go to the Y blocks and find the one that includes the blood alcohol levels. And I wanted to show you what I have done for blood alcohol level. If you go to Chapter 20 and you go down these codes here, what I've done under the Y90 includes blood alcohol level. That just helps me remember that, because this is kind of vague. Supplementary factors related to causes of morbidity. Could be lots of things. But blood alcohol level, BAL, is how you might see that documented or abbreviated in the medical record. Please be mindful that the exercises in this PowerPoint do not address all of the guidelines. Exam questions can relate to all the guidelines covered in the chapters planned for each week, not just those in the PowerPoint. And always follow the assignment schedule with regard to any specific chapter assignments. If you have any questions, please post them in the discussion board and I will answer them. And I thank you very much for your attention. Have a good day.